More than 500,000 people in the United States have a rare genetic disorder called primary immunodeficiency disease.
PI disease affects the cells, tissues, and organs of a person's immune system and makes them highly susceptible to infection. But as Delane Cleveland reports in today's Health Check, PI disease is treatable with early detection and a little help from the public.
This week at the Midwest Immunology Clinic in Plymouth, more than a dozen people got together for a common goal: to raise awareness for primary immunodeficiency disease.
People with immune deficiency have recurrent infections with common things: sinus disease, recurrent ear infections, bronchitis several times a year.
It affects about 500,000 people in the U.S.
I've had 17 surgeries. I've been hospitalized probably 30 times.
Frank Meuers of Plymouth is one of them.
There was a couple of years where I simply got out of work, got in the car, went home, went to bed. That's all I could do.
It was the result of chronic fatigue, a byproduct of immune deficiency. But doctors say it can be diagnosed at an early age with a simple blood test.
If they have low T cells, they're looked at to see if they have this disease. If they do, they can be cured with a bone marrow transplant before they ever get sick. In the past, we had to wait till they had almost a lethal infection before they're diagnosed.
Frank wasn't diagnosed as a baby. His treatment requires people to donate plasma.
Just getting the word out that we want people to come out and donate plasma is worth a lot.
If we don't have blood donors and plasma donors, we don't have a source of antibody to give these patients. Their life depends on it.
It's a message this group wanted to get out as they braved the snow and cold to commemorate World PI Week.
I was lucky enough to survive childhood and get into adulthood where they finally could come up with a treatment. Otherwise, I would have just been one more statistic.
In Plymouth, Delane Cleveland, 12 News.
Doctors say that since January in Minnesota, blood is drawn from a newborn baby's heel and tested by the Department of Health to see if they have PI disease. For more information, you can go to our website, 12.tv.